Today we are talking about falls in the elderly. I am Dr.Kelum Pelpola and I am a consultant in general medicine and geriatric medicine. Today we are talking about falls in the elderly patient. So why do elderly patients have increased chances of falls? If you look at it, walking, fast walking or running, they are all coordinated efforts, and actually although we think that they are simple things because we've been doing them for years and years, they are not too easy to start with. If you know, when you were small, you took a long time to get ready to walk and you had to do a lot of coordinated effort. And a lot of systems such as the eyes, the ears, the brain and the nervous system and the muscles all have to coordinate together to walk properly. If there's a problem in any of these, it can make someone fall. But at the same time, the reflexes of someone gets worse when they age. And when that happens, the chances of falling also increase. Say for example, if you have a vision problem, you may not see where you're going and that may make you fall. At the same time, if you have a problem with your hearing, that can affect your balance and equilibrium. So that can also be a problem which makes you fall. At the same time, when we get older, there can be certain other issues such as problems in the heart or the lungs, which make our breathing and all have problems, or sometimes there can be conditions in the heart such as heart failure or aortic stenosis, which could lead to problems in the heart which can make you fall or have blackouts. So these all of these problems come together, and most of the time in the elderly there's no one reason but multiple reasons as to why a person could fall, and there are multifactorial falls. Sometimes they are accidental falls, but most of the time it is more than one cause, and those are called multifactorial falls. So what can we do to reduce the number of falls or to prevent falls? So at home it's very important that you make sure the lighting is good, that there's no water on the floors, especially inside bathrooms. If there's water on the floor, make sure that you get rid of it very quickly. You can install things like handrails in certain areas in the bathroom, so even if there's a chance of fall, your elderly adult can hang on to them, so the chance of falling is minimal. At the same time, if they have problems with their hearing aids are important. Their vision, glasses can correct them. Those are also important things to do. If they have problems with their heart, it's important that we look into that and sort them out. Say for example, certain heart problems including slow heart rates may need specific interventions such as pacemakers, but those have to be decided by the specific specialists who see them. So what do we do if one of our elderly adults fall? If they have a head injury, it's very important that they get assessed by a doctor. If there's something like an external wound, it's important that it's properly dressed or sutured as necessary. If they're on blood thinners such as aspirin, clopidogrel, warfarin, or the newer anticoagulants called NOACs or DOACs, it is important that they are properly assessed, and we need to see whether they need something like a CT scan or some kind of imaging to look for any internal bleeding. If they have any pain in their hips, it's important to see whether they have any hip fractures. Hip fractures are very common in the elderly and can be an important area to look at, because if you have a hip fracture, it can make your elderly adult immobile for a long time. Despite the age, a lot of patients worldwide tend to get operated on hip fractures now, because that helps them to regain mobilization and get a better quality of life. So those are the things that we need to do if we have a fall. Thank you.
Kings නිරතුරු විශ්වාසයෙන් ඔබ ළඟ රැඳෙන්නම්.